Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just great, thanks.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID-19, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, August 1st. We invite you to submit any questions or comments you have down below or at any of our social media linked in the description. Starting with that latest COVID number. Average COVID deaths per day in the last reported week were down to 21. The same week in 2024, we saw 63. Dr. Murphy, reactions to those numbers, as well as the other COVID indicators we're seeing in the United States?
Well, this indicator hasn't changed for over a month now, but remember, death from COVID is the last marker that occurs because first you get infected, then you get sick, then you get sick enough to go in the hospital, then you go in the ICU, you survive or you don't survive. So there's many weeks. Whereas the other ways we look at things now, because COVID itself is not a reportable disease, is we look at viral activity in wastewater. So it's still low. There have been parts of the US, the United States is such a geographically huge place, but in the West, it had popped up to moderate, and in the South, it also was moderate, and then it dripped down again, and then there's below low is very low. So it's up a little bit. And I think that another story that we're going to talk about next is emergency room visits. So those oftentimes get reported, or they get reported from a different area, and we can just extrapolate from that. So COVID-19 related emergency department visits rose about 5% compared with the previous week, mainly in kids 4 and younger. Test positivity where it's being done and measured also popped up about 5%, with levels highest in the Southwest, followed by the South. So it's this wave that we've seen since 2020 and 21, where we get this summer bump. And we're not really quite sure why that happens, but it looks like it's happening again. And the question is, how big will that bump be? We'll see in the next couple of weeks if this really is going to take off.
Mm-hmm. Oh, we have a lot of stories today on the respiratory season upcoming or in the past. One of the big changes that we are constantly discussing is the recommendation changes for vaccines of pregnant women and healthy children. There have been some differing recommendations from the federal realm and now from some of the larger medical institutions in the country. Can you tell us about those differences?
Yeah, so the vaccine recommendations from the federal medical agencies, primarily in regards to healthy children and pregnant women, have been softened. And that actually has a big impact. It has an impact on funding, insurance companies paying for the vaccines and whatever. And, almost all the professional societies and virologists and people that really study these diseases really don't agree with this approach. And so the leading US medical organizations, the American Academy of Pediatrics, the Infectious Diseases Society of America, the American College of Obstetricians and Gynecologists, and many state health departments, including Wisconsin, California, Washington, Oregon, Illinois, Massachusetts, and Maine, among others, they're setting their own standards. And they're saying, these healthy children and pregnant women should be taking these vaccines because they can get sick, even if you don't have any underlying diseases. So they've looked at safety issues with these vaccines. We've reported in the Danish cohort with over 1.5 million people, looking at people who had the mRNA vaccines versus those that didn't. There is really no safety issues. We have not seen really anything. So it's just the shift is away from the central government to the professional societies that, are really out there following their cohorts, whether it be women, children, or the population as a whole.
And homing in on some of those significant safety issues are the actual infections themselves, specifically for these data that we're going to look into for young children, some of the most vulnerable. There's new data comparing the burden of RSV, COVID, and influenza. Can you help break that down for us?
Yeah, so these three come together now. During the COVID pandemic, when nobody had immunity to COVID, everybody got COVID and nobody got the other diseases. It just outcompeted everybody. But now there's immunity in the population, and so now they compete for each other. So they did a study. This is reported in the Pediatric Infectious Disease Journal, and they reported on 56,000 hospitalized children. And in the final analysis, most of those kids, some 44,000 almost, had RSV. Some 6,500 had COVID, and around 6,000 had influenza. And they report that the RSV and COVID group were a little bit younger than the influenza group. And the most common, of course, was RSV. And this RSV had the most severe disease reported. However, the in-hospital mortality was less. So how could that be? Well, the treatment for RSV is actually pretty good. You can give these monoclonal antibodies, and the kids just luckily bounce back. You can also prevent RSV if the mother takes the RSV vaccine herself in the last trimester. She'll make antibodies that will protect the baby, because it's those babies under a year old that are really at risk. And there's also monoclonal antibody treatment for these kids. If you can get a hold of it, just give it to them and they won't get it, because RSV can really be devastating for these very young babies. It's quite a scary condition. And the hospitals, there's not a lot of pediatric beds left anymore, because so many of the diseases can be treated as an outpatient, but they really fill up with these kids with these diseases during the winter respiratory season. So that technically starts around December 1st.
And something rarer, as you touched on there, influenza seasonally is not that it's a low burden, but it is lower than COVID-19 and RSV. But there have been some startling findings in children who have gotten very, very sick from influenza. Can you tell us about this specific rare case?
Yeah, there have been some. It's rare. In the last 2 years, there's only been 41 cases of this neurologic necrotic form of encephalopathy or encephalitis due to influenza. It can be devastating. It can be lethal. I mean, it's a very scary complication of influenza. And the scarier part of it is 71% of those kids. Now, this is only 41 in 2 years, but if your kid is one of those, you're going to really, it's terrible. It's tragic. Those 71% of those kids that got it were previously completely healthy. So this can just cause this terrible necrosing encephalitis. And so, that's why the influenza vaccine is recommended for everybody 6 months and older.
Very scary. And this also comes along with the fact that in 2024, the fraction of kids exempt from vaccine requirements rose to 4.1% from 3.7% the previous year. Can you just give us a quick comment on why these vaccines are so important?
Well, you have people in the important government agencies now that really don't believe in the vaccines. They don't believe how important it is, and they think it's a personal decision. They want to go backwards in terms of protecting the population. And, that rubs off. People say, I don't want to take it. I don't, the head of the Department of Health and Human Services doesn't think it's necessary. It's my personal decision, and you can do that. But you're going to pay the price. You're going to pay the price for that with the health of these children. So
Mhm.
the proportion of kindergartners has popped up. And it just continues. It's not a huge amount. It's still less than 5%. But when you get more than 5% opting out of the vaccines, measles is number one, but it could be really anything. I mean, everything else is going to become more and more common, and these kids are going to get sicker and sicker.
Mhm. And on the topic of federal health agencies, we just found out this week that the Senate has confirmed the new CDC director. Can you give us a little bit on her background?
Yeah, this is Susan Monarez. She's a PhD. She's now the director of the CDC. She's been acting as the director since January and was officially nominated in March. She is not a physician. She's the first non-physician to lead the agency in more than 70 years. She's a microbiologist and immunologist by training, previously served as the deputy director for Advanced Research Projects Agency for Health within the Department of Health and Human Services. She's also had several other roles in government, including the Office of Science and Technology and the National Security Council, both within the executive branch. So she's a highly trained person that works in the field. She's not a medical doctor, but she's certainly very smart. And I wish her all the best of luck, and I hope she continues to make the CDC the leading authority in protecting the health. One thing she has said is that she wants to focus on infectious diseases. This is kind of how the CDC started. She doesn't want to, the CDC has branched out, into gun violence and obesity and diabetes and all these other issues as a public health measure. And she wants to refocus the CDC just on infections, and those other issues should be handled by other agencies or other institutes within the NIH or within the government in terms of how they're going to be addressed. So that it will be a shift in the CDC, but she at least wants to focus on the infections, and she believes in vaccines, and hopefully she'll lead the CDC and have an impact on the health of the nation.
Mhm. And one of the biggest infections that she'll be looking at on her desk right now is the measles outbreak here in the United States. Can you give us the latest update on measles cases?
Yeah, so the numbers are still going up. There's over 1,300 cases so far. There's like over 4,000 in Canada. So it's not limited to us. But it's a 14 case increase from last week. It's still the same. 3 people we've reported in the past have died from measles, but remember, it can be a lethal disease. It's primarily, it causes a lot of hospitalizations. 169 of the people have been hospitalized. Overall, the increase from 2024 is over 4.5-fold. So, there's a lot more than about there. And remember, in 2000, when a lot of people were vaccinated, there was none. It was zero. So we can go to zero, but it's going to require people being vaccinated.
Absolutely, a lot of tough work ahead there. And looking back, the CDC has released their latest morbidity and mortality weekly report, and they were able to describe a long-term outbreak of Salmonella linked to raw milk consumption. We've talked about it in pets, haven't talked about it as much in humans. Can you bring us those numbers?
Well, salmonella is one of the leading causes of food poisoning. It can be very severe. It can kill you. It also can be treated if you diagnose it appropriately. So it's been linked with raw milk for a long time. This is absolutely nothing new. And there's this push now to drink non-pasteurized raw milk, that it's better for you. Well, it's actually puts you at significant risk, not only for salmonellosis, and this is an outbreak that has 171 cases in it right now, and which makes it one of the largest foodborne outbreaks to raw milk and in recent U.S. history. But there's other things that raw milk can give you. E. coli, Campylobacter, Brucella, Cryptosporidium. These are all bacterial infections, parasitic infections that can make you very, very sick. So raw milk is not a good idea. And if you are going to take raw milk, whatever benefit you think you're getting, you're going to also add the risk of getting one of these foodborne illnesses.
Mhm. Now, something else that we touched on last week that is extremely, extremely rare, but consequently, we have seen another case is this brain-eating amoeba. Very sadly, a 12-year-old boy has recently passed. Can you tell us about this case?
Yeah, we talked about this already. This is caused by this brain-eating amoeba, Naegleria fowleri, that thrives in warm, fresh water. We talked about this case before, a 71-year-old woman who they think it came from an RV park water source. They never found it in the water source, but they can't find anything else, any other source that she could have gotten it from. It comes from contaminated water. So between 1962 and 2024, there have been 167 reported infections, and all but 4 of them were fatal. So if you get it, it's 98%, 97% fatal. It usually is not from drinking the water, but if you get it in the nose, like the 71-year-old woman who got it was irrigating her nose with this water. And the boy was swimming in a local reservoir. Perhaps he had a cut or something. We don't really know, but it's not from drinking it. It's from getting really exposed to it through a cut or the nasal cavity. So, according to the FDA, tap water is not safe for rinsing nasal passages, instead recommending the use of filtered, boiled, or otherwise sterilized water to avoid this potential rare but lethal complication.
Of course, not something you're doing every day, rinsing out your nose, but better to be safe than sorry if you are. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise today. It's much appreciated.
Well, great. Have a great weekend.
Thank you. And I hope you all have a great weekend. Thank you for joining us for this week's episode of Ask Dr. Murphy. Of course, if you have any questions or comments, please leave them down below or at any of our social media linked in the description. We'll see you next week. Bye-bye.